Hi, I'm Dr. Gilbert Ross, Executive and Medical Director of the American Council on Science and Health. The Council, we refer to it as ACSH, was founded in 1978 in New York City by a group of scientists who believed that sound science was being ignored too frequently by the decision makers who determine and influence public health policy. We are dedicated to educating Americans about the real health risks in life, things like smoking and obesity, not the perceived and imaginary threats, like trace amounts of chemicals in a plastic container or arsenic in apple juice. Folks who say we need to spend billions of dollars to, for example, reduce lead levels down to parts per trillion because of some hypothetical threat, don't have public health benefit in mind. They're only trying to make a political point. Since the beginning, ACSH has always stuck to the science, peer-reviewed science. We never shoot from the hip and make claims that aren't backed by good old solid science. One of ACSH's strengths is our Scientific Advisory Board, which is made up of nearly 400 prominent physicians, scientists, and public health policy experts. All of our scientific publications are reviewed by experts in their respective fields. And all of our publications are published in an academic or technical version, and we also produce a consumerized version that is shorter and written in layman's language, so it's accessible and comprehensible to a much wider audience. We educate the public and the media by issuing press releases, writing articles, editorials, and letters to the editor, and appearing on radio and television. We host informative websites. We produce and distribute a daily e-newsletter, ACSH Dispatch. We host and participate in educational forums and seminars. And we testify at legislative and regulatory hearings. And of course, by communicating via social media, we tweet, we blog, and we also produce videos. ACSH's work is important because we're one of the very few organizations trying to bring sound science back into the discussions and debates about health risks. We know we're fighting an uphill battle. It's so easy for activist groups to convince people that something is toxic because the media buys into the sensational spin. The truth is, bad news leads. Good news doesn't. We hardly ever hear about the fact that cancer rates are actually going down, but we hear plenty about vaccines possibly causing autism, when in fact vaccinations are safe and incredibly important for everyone's health. That's why ACSH exists, to make sure the voice of sound science is heard and repeated often. Thank you for watching. I hope you'll take the time to listen to our question and answer video, and that you'll consider supporting ACSH. And for more information, please visit our website, acsh.org.